What does it take to actually reach herd immunity when it comes to COVID-19 in America? Where is that tipping point? It's one of the questions I asked the CDC. I have their full statement to Smarter News, plus a little bit of perspective on this whole conversation. First things first, what does the pandemic really look like in America right now? We know we can't look at just confirmed cases because we've been told since the beginning of this by health officials that there are a number of asymptomatic cases that could be impacting community transmission of this disease. So, what does that even look like right now? We don't really know. Last summer, the CDC told us for every one confirmed case of COVID-19, they thought there were 10 others that they would never identify. So right now we're nearing 29 million confirmed cases of COVID-19 in America. You take 29 million and multiply it by 10, you get 290 million infections. So does that mean the entire nation has been infected with COVID-19? Not so fast. I asked the CDC about this. Is this still the estimate that they're using? For every one confirmed case, there's 10 others they don't confirm. And the answer is no. They actually have some updated information. So for every one confirmed case of COVID, they believe there's nearly 5 others that they don't identify. All right, so you take 29 million confirmed cases, you multiply it by 5, it's still a really big number, right? Not so fast. That estimate of nearly 5 COVID-19 cases for every one confirmed is based on overall national data, but we know there's a lot of differences depending on where we live, so that number could be lower or it could be higher depending on our community. The CDC takes all those variables into account, sifts them all out, and the number that they arrive at is they believe that we've had an estimated 80 million COVID-19 infections in the country. That's their working number. But still, if you have 80 million estimated infections in the United States at this point, and you have the rising number of vaccinations, we're at nearly 52 million Americans who have received at least one dose of the vaccine. I mean, we're still getting up there in numbers, right? We must be somewhat close to herd immunity. Not so fast. Here's what the CDC sent Smarter News when I asked them about herd immunity and COVID-19. Experts do not yet know what percentage of people would need to have immunity, either through vaccination or natural immunity, to achieve herd immunity to COVID-19. Herd immunity means that enough people in a community are protected from getting a disease because they've already had the disease or they have been vaccinated. The percentage of people who need to have protection in order to achieve herd immunity varies by disease. CDC and other experts are studying herd immunity and will provide more information as it is available. The CDC to Smarter News. So after all that, I had to do a little bit of reporting to really understand what we're even talking about when it comes to the possibility or even the promise of herd immunity and COVID-19. Here's what I learned. Herd immunity, as we think about it for the measles, may not apply to COVID-19. We don't talk about herd immunity when it comes to the flu, do we? We just know that flu season happens every year. Could that be the case for COVID-19? We don't know. Not all immunity is created equal. If I get the chickenpox and you get the chickenpox, we're pretty certain that we're not going to get the chickenpox again. But one of the mysterious things about COVID-19 is that it impacts people so differently. So if I get COVID-19 and my husband gets COVID-19, do we actually get the same immunity to the virus? We don't know, which actually leads us to our next point. We don't know the impact of variants. So does one infection of COVID-19 protect you from another infection? Does a vaccine provide better immunity than an infection that you get just from being out and about? Do asymptomatic cases or mildly symptomatic cases provide good immunity or fleeting immunity? We don't know. We don't know the answers to any of that. As you might tell in this report, I'm using the words "we don't know" quite a bit, and that's because we're learning a lot about our immunity in COVID-19 as we speak. One of the things I was reminded of as I was doing my reporting on this topic is just how much we are in the middle of a developing story. What we'll be telling is not just the first year of data, but what we start to see now as we continue to see the number of infections and the number of vaccinations continue to increase. What does the data show us when it comes to cases, hospitalizations, and death? What do we learn from that? That's just going to take a little more time. Why does this all matter? Well, we're trying to figure out, when do we go from being in the middle of the pandemic to being on the other side of it? And that's really what the conversation about herd immunity, about community immunity, is really about. That's why we're asking this question. But in addition to that, you're starting to see public health policy decisions reference some of this information. So in the state of Texas that just pulled back a statewide mask mandate and is going to be opening at 100% capacity, one of the reasons why the governor gave for doing that is saying that based on their confirmed number of cases, they believe the actual number of infections in Texas is 4 to 5 times higher than that. That's the same number that the CDC gave us. And for that reason, he believed that the number of Texans actually recovering from COVID-19 is higher than the number of Texans who are contracting the virus. Different people will take different conclusions from the same data. And there's a whole other debate about whether or not the policies we have in place are the correct ones. That's a separate video. But for now, I just want you to know where the data is actually coming from. So all my sources for this information will be right underneath the video on our website. Questions and comments, let me know. And as always, more on smarternews.com.